I have a very special question to ask you from a very special person to me. Okay. The question is this: if you had the opportunity to talk to a young person, like very young, in their 20s, and they're like, Raul, I'm deciding whether do I do nursing or do I do medical, become a doctor. With your experience dealing with doctors every day, dealing with nurses every day, what would be your advice for somebody like that, somebody young like that?
From somebody young who is trying to decide if they want to become a nurse or a doctor or just work in healthcare in general?
Nurse or a doctor?
Okay, good question. All right. It's a good question because I had this conversation with my daughter who at 13 told me that she was going to be a neurosurgeon, right? At 13. That's what she told me.
Well,
So now she's.
I would say, Raul, is my daughter asking that question. So I give you that much. So I'm throwing it to you. So
Excellent, because I just went and still am going through that with my daughter, who is now 20 and who 2 weeks ago passed her state boards to be a respiratory therapist. So she's in the healthcare. So here's what happened. Being a doctor is completely still on the table for her. So when I was young, if you would have told me that I could be a doctor, to me that was impossible. That's for smart people. I could never be a doctor, right? That's just I had low expectations. I mean, I didn't think that would be possible. Now, dealing with all these new doctors who are coming in constantly, who use me for a resource, I realized I could have easily become a doctor if that's what I wanted to do. I don't. I love the nurse lifestyle more than I love the doctor lifestyle. I'm very happy where I am. But you are right. So, but you're able to. Then I realized, of course, I could have been a doctor if that's what I wanted. Now, so for instance, the question is, my daughter's like, should I just go straight into med school? Should I get my prerequisites, go into med school, and figure it out that way? And the answer is, you could. You could, if you know that that's what you want to do, you can. Now, because there's so many things that you don't know until you become that. And a doctor is no exception. I work with a lot of doctors who are fresh out of school, who are fresh starting 2-3 years. But one of the biggest surprises for me and one of their biggest complaints is the massive school debt that they carry, right? 300, 400, $500,000 worth of school debt. And when some of these doctors start, they're not making the big bucks. There's a lot of nurses that make more money than doctors do in the first 5, maybe even 10 years of their career, believe it or not, depending on their specialty and where you work, right? So one approach, which is what I recommended to my daughter, I says, hey, you can either go to community college and get a 2-year degree in nursing, because I promise you, when you're taking care of a patient, nobody asks you, do you have an associate's or do you have a bachelor's? Nobody cares. Are you a good nurse? Can you handle yourself? I had an associate's from a small community college for the first, 24 years of my nursing career, right? But yet I could get a job anywhere because of all my skill sets, because of all the machines I can manage. Nobody would question it until I finally went back and got my bachelor's. So I told my daughter, if you go get an associate's RN, it's a shorter period of time. I said, and you're going to have, by the time you finish, you're going to have no debt. Now, there's a caveat to that. Right now, there's a waiting list, crazy waiting list for nurses in community colleges. So it might take you a while to actually get in the program. You can go get a bachelor degree at a private school or a university for nursing. You'll knock it out in 4 years. That's the fast way to do it. Fast way to do it. You know you want to do it. You go into nursing. 4 years, you're going to get your nursing degree. You're going to start working in nursing. Caveat, it's going to have a pretty large, debt, anywhere between $60,000 to $100,000 in school debt if you go to a university. And I'm talking if you don't have, if you don't have school sponsors or funding for it, right? So that's the caveat on it. However, if you become a nurse first, before you pursue your medical degree, it's going to be a lot easier for you in many ways. You're going to be used to patients. You're going to be used to walking in rooms. You know the lingo. You're going to have some experience going in. And also, you'll be able to sustain yourself because a lot of people work part-times when they're in medical school, right? And they'll be able, to a certain part of it.
Certain level.
Certain level, certain years they'll be able before it gets to the end. So you'll have income while you're doing it. So there's a lot about, if you don't mind taking the route that's a little longer, then becoming a nurse is absolutely the way to go, because here's what happens a lot of times. Life So you're in there, you already become a nurse, you're starting making money, you want to be a doctor, but all of a sudden life happens and you realize my passion is now this. I've worked with doctors, I realize I don't want to be a doctor. I'm happy doing this, and you have a great career. You never know when life's going to take you another way. Because I've talked to a lot of unhappy doctors who
Yeah.
it's just they were so far into it, they were so vested in it that they can't stop, right? Okay, I'm almost done. I'm going to finish med school. I'm almost done. So let me do it. I don't even really like it, but I got a medical degree. So I'm going to work as a doctor. And they're not always necessarily happy where they are. But if you become a nurse first, you wean all that out. You figure things out. You have more opportunities to grow. And being a nurse is not a bad thing at all. So
Not a bad
I
gig at all.
but you know what? There's a few people out there, not most of us, but a few people who know with every cell in their being, I want to be this and nothing's going to stop me. If that's you, then you go straight into medical school and you attack it because you know. But most of us, we think we know or we don't really know.